Well, good afternoon, everybody, and welcome to today's Business Spotlight. I'm your host, Todd Rodden. I'm a certified business and executive coach. I own Aspire Action Coach here in the Dayton and Cincinnati, Ohio regions. Thrilled to have you join us today. This is going to be a unique story of a Yale trained physician committed and passionate about healthcare, taking it to the next level, becoming an entrepreneur, and really creating a whole new type of service, customer service in the healthcare space, really connecting patients directly with specialists in various domains. So we're thrilled to have Dr. Mark Halsted join us here today on the Business Spotlight. So Dr. Halsted, thrilled to have you join us here. Take a
Great to be here.
second, share a little bit about your background, why the initial passion around medicine, and then how you make that journey, that leap, entrepreneurship, and why.
Sure. Thank you for having me, by the way. Appreciate it. I decided to be a physician very early in life. My grandfather was a family practitioner. His patients really respected their relationship, that he delivered some patients whom I later met as adults when I was visiting him in his hometown. That inspired me about the power of medicine to heal not only through science, but also through personal connections. Um, I've also been entrepreneurial from an early age. So starting in third grade, I began harvesting cherries, for instance, in cherry orchards as a way to make money. So there was, long story short, kind of a convergence of entrepreneurial interest and then wanting to bring my specialty training to patients and providers to make it much more easily accessible, more efficiently accessible from anywhere in the world. I did 3 fellowships after a residency in radiology, so I'm very subspecialized in training. But I never lost the notion that healthcare was really important between people. And I felt as though it's become more and more difficult for patients and their providers to reach somebody like me, who's a subspecialist, when they have questions and need clarification, need advice, would like a second opinion. And so I launched the practice as a way to offer that service to make it simple and easy for them to find us.
So hence MD for Patients was born, right?
MD for Patients was born, yes, and it's not just radiology at all. It's a pan specialty, meaning all specialties covered for all patients, and we cover most countries around the world.
Yeah, so even global, beyond the reaches of the U.S. here, very impressive there. Maybe take a couple seconds, talk to who are your ideal customers out there, right? Because I know it's a blend of not only patients but businesses and also providers as well. Right?
Yeah, on the patient level, our ideal customer is somebody who wants to talk to a team of specialists, if not a single specialist or primary care physician. We do offer primary care consultations as well, who just wants the truth about what's happening, often a more comprehensive review of their healthcare picture than can be obtained in a short clinic visit, often synthesizing information from multiple different sources. So if you've had care across the city or across the country, it's difficult often to get records together and figure out what the whole picture is. Also to improve communication between specialists and primary care providers. It's all too common these days that a specialist will see a patient and the primary care provider never gets a report or a consultation notes, so they're left in the dark, and patients are usually not comfortable trying to convey the information they learn from the specialist to their primary care provider. So it was, as far as the patient and the provider goes, it's anybody who wants to have access in real time with a real conversation with a real human who's very experienced and well trained and interested in communicating with them and not rushing them to make really important decisions in their lives. Another ideal customer, for instance, is a self-insured employer who has employees, whether only domestically or remotely within a state or within the country or even overseas, who may be traveling, may be deployed overseas for temporary or for longer term, and want to have continuity of care with with a U.S. trained and based physician that may be more comfortable for them, and somebody they can access virtually who's aware of their case and can support them no matter what happens to them overseas.
So I'm curious, kind of build upon that, and I love that for the employer standpoint in this world of very competitive hiring, talent retention, a way of a differentiator as an employer, right? That I provide this access for my employees.
Yes, I think healthcare, I consider it a target-rich environment for improvement. There's a lot that's wrong with healthcare, and I think we're all aware of that. If you can be an employer who truly cares about your patient, I'm sorry, I said patients. If you could be an employer who truly cares about your employees and their well-being and making visits to specialists convenient for them so they don't have to take a whole day off and travel to do an update consultation with a specialist. If you can offer services to them that keep them healthier and on the job more consistently, you're doing yourself a favor and you're doing them a favor. And I think it is a differentiator because it's so rare to have that kind of access for most employees. So it's about peace of mind and it's about truly caring about your employees. So we welcome those kinds of partnerships and collaborations with employers just as much as we do with patients or providers.
So you launch the business, typically, there's some learning, especially around how to market the business, where to, what channels, what paths, what approaches bear the most fruit in terms of generating leads and sales. So what have you and the team learned so far?
One of the things we've learned is that everybody's a patient, first off, so nobody's excluded from being a patient. But patients often don't have any idea that this kind of service even is possible or exists. So our biggest challenge, I think, has been to try to educate, I don't want to sound too grandiose, but to educate a large percentage of the population that we even exist. Because I can't think of a person I've explained to about what we do who hasn't said, I could use that service, or my uncle could use that service, or my spouse could use that service. At some point in their lives, maybe multiple times throughout their lives, whether it's a chronic condition or a new confusing diagnosis, to have access to somebody you kind of wish was your relative so you could just call them whenever you have a question and you wouldn't have to wait 6 months to see them, which is not an uncommon wait time for a first available appointment for a specialist. In fact, we're hearing 12 months often as a first available.
Yeah.
Well, that's a really long time to wait if you've got a very stressful situation and you have questions about it. So for us, it's about trying to deliver the kind of care we would want to have available for ourselves.
Mm-hmm. I'm also curious because part of that is you have to build a network of providers as well. So what have been keys for building out that network as well?
Well, I trained in some really great places, and my wife did too. She and I met very early in college, and so we went to the same institutions, but we were operating in different spheres. She's in a different specialty from mine. And we developed great relationships and friendships with colleagues and professors throughout our careers. And so reaching people who are really outstanding in their fields through our personal networks was actually pretty straightforward and a lot of fun. And then from there, we have a presence on social media. We have been reaching out to people directly through email and et cetera, to try to reach other practitioners who feel as we do about the importance and power of offering better access to patients when they need it. So those networks have been growing, and it's been really gratifying to see that happen.
Yeah, great. So I think you already might have hinted around this as well. We as entrepreneurs, our journey is never a straight line. There's some hills and some valleys, some twists and turns. So
Right.
maybe share with us a past challenge that you and the team encountered. How did you overcome it? And what did you learn from that?
I have continuously been surprised at how it feels like brainwashed a lot of people are about healthcare. Patients and providers feel as though it can't be better than it is. And I don't think anybody would argue that it's perfect right now. So if it's not perfect, then why can't it be better? I realize there are some very complicated payer issues, insurance issues, access issues, et cetera. But when you cut down to the basics and you step back and you really think about this, as I've spent a fair amount of time doing, the basic elements are scientific excellence and expertise and experience and human experience and communication and connectivity, respect, the kinds of things that my grandpa really wanted to bring to bear with his patients. When you combine scientific excellence and human compassion and expertise and the new technologies that are coming out all the time, which you can leverage by engaging specialists who are at the top of their game, then you've got a really powerful combination. And so I think waking people up to the notion that this can be done better has been a challenge, but it's been enormously satisfying to think about it and to start to build connections with other practices and physicians and patients who are now starting to recognize the value of this.
So what's a challenge that you've got right in front of you now that your team's trying to solve for?
One of the things that we're doing is reaching out further and further from the area of the United States where we started. And so we're starting to build more and more international connections. That's been very exciting. US healthcare and research and development have been leaders for decades. And it's really inspiring, and it's a lot of fun to talk to people in other countries who are interested in working with us, partnering with us, collaborating with us to offer better health care expertise than they can in some of the regions of the countries that they serve. And that's what we're built for. So that's been a challenge. It's also been a great source of fun and enjoyment.
All right. I'm going to probably dive a little deeper, more of kind of a technical process question here, just because, here in the US, we've got a different healthcare model. There's the big insurance companies, whereas you talk about international expansion where a lot of state-sponsored healthcare programs. So how's that interplay different than for you and MD for patients?
Well, there's always the opportunity for a patient or a provider to simply pay cash and work without having to bring in insurance. It opens a lot of doors when you can do it that way because, for instance, if you want to practice healthcare in the US, you need to be based in the US if you're charging Medicare, Medicaid for services, as just one example. But if you're not charging insurance, then that is not an issue. So that's one way to overcome it. And then also we're working with other countries to find ways to work within their systems such that our services can fit as seamlessly as possible into their health services that are completely covered by governmental funds.
So you've built quite a strong network already, but I'm curious, what's your vision for the future? I mean, what's your dream, 5, 10 years, however long your horizon is down the road for MD for patients?
My dream is that when people have a healthcare issue, whether it's chronic or new, even routine, and they have a question, that they realize that they are not alone, that they can reach out to us easily, and that they can much more quickly than they might think get access to accurate information that they can use to determine next steps, to understand their situation, to make a plan, to be connected with local physicians with whom we can work to help them deal with the issues they're facing. And that's true wherever they are in the world, whatever nationality they are, with a few exceptions. That, I think, is a dream for all of us when we sit back and think about, why don't I really enjoy healthcare as a patient right now? Let's just work together to make this a simpler, more efficient, more cost-effective thing. I mentioned you mentioned the differentiator element of it for a self-insured employer to show compassion for an employee, but think about the cost savings for a self-insured employer who can more effectively and more inexpensively and more quickly get their employees back to health so they can be on the job in the teams working together on behalf of the employer, where everybody benefits.
So as you continue to grow, do you see yourself adding other types of services, other service lines in the mix?
Yes, we have a roadmap that has many, many additional verticals and look forward to continuing to roll them out.
Okay. I know you mentioned one before we started the podcast to me around MD for accuracy as well.
Yes, it's a separate practice, but the concept is to offer accurate evaluations of situations, for instance, in a risk management scenario. So if there's an untoward event at a hospital, a risk manager can contact us at MD for Accuracy, and we can, very early in the course of an event, render an opinion about whether or not standard of care has been violated, whether there was a mistake made, whether there are process improvements that can be made to reduce risk and to help a specific patient as well as to help future patients throughout an organization. We're very excited about that aspect of it. We also can work with insurers who have similar questions about expertise requiring answers in healthcare. And then also we can work with attorneys if they want to have consulting experts who can help them understand the merits of a case. And if need be, we can also serve as expert testifying witnesses if they request that.
Okay. Yeah. So continue to branch out and scale the business even more. So,
Yes.
um, so oftentimes, doctor, the most important decisions are the who. It's who we surround ourselves with, how we build our teams. So I'm curious, what have been your key success in terms of building your team? I think you probably especially have some specialized skills, whether it's providers in your network or the direct staff that you may have.
Yes, I think that the best way to build a great team is to pick people who have a lot of talent and then try to work with them to figure out where their talents are best used. So kind of let them declare what things they can do best and don't make them fit a square peg in a round hole. Give them an opportunity to shine, and that makes a very excited team and a team that can work together with synergy, not just individuals performing tasks.
I'm curious, any keys on where you've been able to find those kind of folks, right?
Yeah, a lot of it is personal networks, professional networks, colleague networks. Sometimes it's luck, to be honest with you. For instance, I have a business strategist who is a nurse and JD and a PhD all at once. So
Okay.
she has decades of experience in healthcare and in litigation and in risk management, as well as in administration of federal insurance programs and in large organizations as well as small. So that was really kind of a very fortunate referral. I think you just keep your ears open, keep your eyes open, be open to new opportunities and to new connections at all times. And sometimes they work out really well.
Okay. Kind of an extension of that is, kind of making sure you have a culture that you feels positions you to prosper as well. So what are some of the values you try to emphasize within the organization?
Well, one of them is that we're about trying to help patients for the right reasons. I mean, I shouldn't even say most, every one of us as physicians went into medicine for what I would say the right reasons, to want to help patients for a love of medicine and medicine, healthcare, and science, biology. Often an emphasis on communication, transparency, dignity, respect. Those are the kinds of values that we cherish and that we promote. And unfortunately, it's often difficult to convey those kinds of priorities if you have a 7-minute clinic appointment and you have a bunch of questions you have to answer and address.
Yeah.
So trying to bring that culture to bear has been a privilege. It's been a challenge, but I think, again, it's a matter of kind of waking up to how healthcare can be better. I have decided, at least to this point, not to accept any external funding. So I'm self-funding this practice. And the reason for that at baseline is that every one of us has been in a practice where venture capital came in and started to focus on the finances more than the real mission, which is patient care. And we've found it more and more difficult to be the physicians that we dreamed of being when we chose to enter medical school, when we slogged through chemistry classes in college. We put in those huge long hours as residents. A lot of us didn't think that we were going to be under productivity pressure to this extent. And we've dreamt of practicing this way. And I decided the only way to make sure it was going to remain that way was to remain fully in control of the priorities and directions of the practice.
I love that, man. Hey, you're really sticking to it, sticking to your guns, right? There'd be that natural temptation to, hey, get that capital infusion. We can go farther, faster, but at much risk of the whole values and why you even had created the organization to begin with, right?
Yes, it's a personal thing for me. It's not just that I'm a physician and I have entrepreneurial interests. I have, as a patient myself and as a family member and as a friend of other patients, seen very difficult situations that could have been far, far better for the patient and their families had there been better communication, better access to physicians, a willingness to be more transparent on the part of the physician, a willingness to communicate with other physicians in a non-threatened way, and in a way where really the focus here is on the patient and their case. It's nothing else. When you think about it, why are we here? It's to render the best patient care that we can. And so for me, this is a personal passion. This is something that I have recognized is sorely needed. I think the problem's getting worse. I've been in healthcare for almost 4 decades, And I've certainly seen, I think, a deterioration often in physicians' ability to deliver the kind of healthcare that we want to.
Mhm.
And it's a shame because the technology is so incredible. I know this as a super specialized radiologist,
Mhm.
and the technology in all kinds of specialties is very advanced. So I've always been disturbed that we risk losing the humanity when we are surrounded by so many great tools. And I'm determined at this stage in my career to make sure that the practice that I'm leading doesn't lose track of the fact, or I should say, it doesn't lose sight of the fact that patients need physicians who are human and who can interact with them as humans, but who are backed up by outstanding technology. That, in a nutshell, I think, is what we're trying to do. And essentially be the extended family for patients they wish they were related to when they need us.
Love that. That's great. Especially, I mean, you sense, as a patient myself and an observer, you just see kind of the market kind of consolidating, more and more practices becoming more groups, bigger enterprises, right? More of a kind of a corporate feel, right? And you're kind of
Yes.
countering that, right? So.
Yeah, and that's why if I ever accepted external funding, it would be under very, very tight circumstances where I retain control over the priorities, because it's the culture of caring about the patient first that I think is the most crucial.
So, Doctor, our audience, entrepreneurs, many of which oftentimes are kind of earlier in their stage as an entrepreneur as well. So, what would you share as maybe your keys to success? Or maybe another way to look at it is, what do you wish you knew then that you know now?
It is, in fact, harder than you think. I know you know that. I've seen you mention that, actually. It is harder than you think. If you're doing this, you're gonna be putting in far more hours than you anticipate. I'm still at the 18-hour days where I live, breathe, and work this all day long. And you have to love what you're doing, and that's a cliche, but it's true. You have to really enjoy and be passionate about what you're doing, because you're going to end up spending so much time doing it that you won't do a good job if it's not something that's personal to you.
Mhm.
I also think it's important to look at where your talents, skills, experience, and training are. If you've got a unique skill set or a background that helps you really excel in an area where you see problems that you want to solve, that's a good place to start to figure out how you want to change things. And I would also say take off the shackles of whatever brainwashing or conditioning you've been under to think that your industry can't change, because it can. It's just a question of being committed enough to work the hours and think carefully through the problems and try to solve them. That's how you can actually create change. That's what we're trying to do, even though healthcare is a behemoth. I figure we can't change all of healthcare, but we can demonstrate a better way to approach it, and hopefully it catches on.
Yeah, yeah. Love it. So what are the best ways for folks to learn more, to stay connected, and to follow you and MD for Patients?
Sure. So there is a website, mdforpatients.com. It's FOR, not number 4, but mdforpatients.com.
Okay.
And we have a newsletter. You can go to the website. You can learn more about how we operate. You can request a consult on the website. You can sign up for our monthly newsletter and stay abreast of us that way. There's a phone number as well to reach the practice. And if you have a question, if you want to talk about a particular case or a collaboration, we'd love to hear from you. We also are on LinkedIn, MD for Patients, and we remain active on social media. So that's another way to reach out. You can reach out to me personally through LinkedIn as well.
LinkedIn. Uh, do you have any special offers or incentives for our viewers?
I do. Yes, we will take 10% off the regular rate for a consultation between now and July 31st, 2025. So if you have any interest, I encourage you to reach out. Let us know that you found us through this podcast, and we will be happy to honor that discount. We look forward to talking to you.
All right. Encourage folks to take advantage of it, right? This would be the summer that you address that issue maybe you've been putting off, right? And get expert advice around that. So
yes, and I do want to mention, it doesn't mean that you have to have a specific question. Let's say you want just to have a relationship with us where you might use us in the future if you have a question. That counts. That's fine.
okay.
We would be happy to develop at least an early discussion with you about how you'd like to work with us. So I don't want to make it seem as though if you break your leg in September, you're out of luck.
Um, I'm glad you mentioned that because actually my prior comment kind of, I think, uh, is symptomatic of some of our healthcare challenges. We wait till we have an issue and then we need to go look at it. Hey, no, let's have a proactive conversation. What are the things we could be doing to stay ahead of the game, right? So,
Yes, and I'd also say anybody who's been around for any length of time already has a medical chart that's bound to have inaccuracies in it because not every physician is aware of every other physician's opinion or of all the diagnostic testing that's been done, et cetera. So we can perform a checkup of your current status and let you know if there are issues that we think need to be clarified in the medical records. That's something that we can do. Or if there are studies that we would recommend maybe you need, or just reassure you that, oh, that lesion that was mentioned in your chest CT was seen on a prior chest CT. We can tell that because we've reviewed both of them. You can be reassured about it. You don't need to go see a surgeon about that. So there's savings that can be realized by making better use of current data
yeah.
and all existing prior data that you've already paid for and the system's already paid for. So yeah, there are a lot of ways that you can engage us even if you don't have an acute issue.
Okay, yeah, and really kind of tying together sometimes those disconnects that we feel as patients as we move from different specialists and our primary care. So I love that. So,
Absolutely.
so as we wrap up here, Doctor, what are you inspired by?
I'm inspired by the rekindling of relationships I haven't kept at. I hate to say it, but haven't been in touch with everybody I trained with since college, you know? So it's been great to reconnect with people and to meet new colleagues through my friends and through my personal network, and also to meet people who have reached out to us through LinkedIn or through the website and want to collaborate with us and want to have consultations by us as patients, want to be able to reach out to us more easily as physicians, whether they're primary care physicians or specialists, because they recognize that collaboration between physicians is all too rare these days. It's obviously better for patient care if all the physicians caring for a patient are on the same page and have easy access to each other and can work in real time together. That has made me really optimistic about the future. And so I would say that's my best answer to your question.
I love it. Yeah, making those connections and a great future. So thank you, Dr. Halsted, for sharing your story and the journey for MD for patients and exciting times with what lies ahead as well. So,
thank you very much. I really appreciate the opportunity. It's been great to have this conversation. I look forward to more.
all right. And to our viewers, we're thrilled to have you join us today. I hope you took great notes. You can go back and rewind and get some key points in here as well. Just as you can tell, Dr. Halsted, very passionate about what he does, very committed to really solve some of the challenges we have from a customer service and patient experience in our healthcare here as well. So thank you for joining us. I encourage you to hit that like button, but also if you haven't already done so, hit subscribe so you can receive future messages from other inspiring entrepreneurs like you heard from the doctor here today. And with that, we hope you all have a terrific day. Thank you.